Today we have 13 new cases, bringing our active cases to 142. Variants of concern make up 20% of our active cases. No long-term care homes or retirement homes are in outbreak. 10 people are hospitalized and 2 are in the intensive care unit. I believe this is the highest number of hospitalizations we have seen so far in the region. On a more positive note, nearly 59,000 residents of the Southwestern Public Health Region have now received at least one dose, which is 27.6% of the total population. Thank you to everyone continuing to follow public health measures. Your actions are making a difference in our community, and I hope we continue to see a downward trend in our case numbers in the coming weeks. I strongly encourage anyone who is eligible now for a COVID-19 vaccine to get it. There are still lots of appointments available at our clinics in St. Thomas, Woodstock, and Tillsonburg for the month of May. Everyone over the age of 60 is eligible. We know the past months have felt particularly tough. COVID continues to challenge us in every way. I know we are tired, frustrated, sad, and worried. More vaccine is on its way to our region next month, and eligibility continues to expand regularly. And my colleague Jamie will speak to this soon. So this concludes my remarks, and I will now hand this media conference over to Jamie Fletcher, Program Manager and lead for our COVID-19 Immunization Task Force, who will answer some frequently asked questions we receive from our community. Welcome, Jamie.
Thank you, Dr. Locke. It's my pleasure to be here and to speak with all of you and to provide a brief update. As Dr. Locke mentioned, our Tillsonburg clinic opened up at 45 Hardy Avenue in Tillsonburg yesterday. That was an exciting day, and this expands our availability to offer appointments throughout our Southwestern Public Health region. Our eligibility, as Dr. Locke mentioned, remains at 60 years of age and older in our mass immunization clinics in St. Thomas, Woodstock, and Tillsonburg. And you can book appointments at www.covidvaccinelm.ca or by calling a number that we're happy to provide. Our call center is actually also able to help book appointments if anyone is struggling. And we do have a help list for those 60 and over to reach out to us and ask for assistance. We're more than happy to help book appointments. At this time, we do have a comprehensive list of those who are eligible on our website, Southwestern or swpublichealth.ca, and that list, as Dr. Locke mentioned, is expanding as vaccine supplies look more encouraging towards the end of the month of May. So that is my update, but I know we do have some frequently asked questions that I'm happy to address.
Thanks so much, Jamie. I'll ask the first question, starting with essential caregivers for individuals who have an eligible health condition. Can you define this for our community? And are companions eligible as a caregiver or partners of pregnant individuals?
So we know that there is more demand for vaccine than there is supply. And so the province of Ontario has provided eligibility definitions for eligible essential caregivers for those highest risk and high risk health conditions. Some of the wording around those that we'll be looking to define this group would be that individuals who are defined as essential caregivers would be needed to provide personal and sustained support with activities of daily living. And those types of activities would be toileting, ambulating, mobilizing types of behaviors, and that support is required on a daily basis in order to support the individual with the health condition that's listed. So not all groups and not all individuals would be eligible under that definition. And so we'll be working to provide clarity to those groups over the upcoming days. But again, not all individuals or companions would be eligible under that definition. It would be sustained personal assistance with activities of daily living.
Thanks, Jamie. Second question, will there be enough vaccine for my second dose?
That's on everybody's mind, and as the interval for second doses has pushed to 112 days. What we know is that provides some worry for individuals, but our province and locally, we're confident that we'll be able to meet those needs when the time comes. And we're looking at those numbers very closely, but we do want to continue to not lose sight of the importance of first doses in arms for as much of the population as we can. But as we've had glimpses of the upcoming supplies in the province of Ontario, it's looking extremely encouraging for those who are waiting to become eligible, as well as for those who are coming due for their second doses. It's looking great.
Great. Number 3, how can I sign up to be a volunteer?
So right now, where our energy is focused on our internal resources and ensuring that our mass immunization clinics are staffed appropriately. But we can't do this work without volunteers, and we're so grateful to the groups that have stepped forward. At this point, we're working with specific groups of volunteers, and we're not reaching out for individuals who are offering their services, although we are so grateful and overwhelmed with the amount of offers that we have received. There is the provincial opportunity to register your name using the Ontario Matching Portal. And so all you have to do is go on Google and type in Ontario Matching Portal, and there's opportunities for you to volunteer your services and your skills and your knowledge and your expertise in many different ways. So we would encourage anybody on an individual basis to reach out through that portal.
Thank you. Number 4, when will essential workers who cannot work from home become eligible?
So at this point, our vaccine supply is matching the number that is eligible. So together with Dr. Locke and her peers and neighboring health units, we're determining the amount of vaccine and how many people we're able to open up those eligibility criteria to. So at this point, we're watching very closely, and we know it will come soon. But at this point, our doses are dedicated to those 60 and over, and those in the highest risk and high risk health criteria at this point. And we do have some eligible work occupations that are eligible, such as healthcare workers, and we've newly announced childcare workers in licensed childcares will become eligible as of tomorrow. But at this point, because of our vaccine supplies, it is limited.
And does that include teachers?
So at this point, teachers are not included unless they're specifically involved in the support and education of those with special needs. And those who fit that criteria would have been offered a username and a login from their employer by meeting such criteria.
And another follow-up to this discussion is, are all essential workers eligible in phase 2?
So phase 2 takes us very closely into phase 3, and we will be hoping that with the age bands and with the opened eligibility to essential workers, that everyone will have a chance to get a dose of vaccine. Ahead of schedule is our hope as vaccine supplies increase, but we are looking on a week-by-week basis at that criteria and trying to match it to our vaccine supplies, but we will be keeping an eye on that closely. We so appreciate that everyone is so eager to get this very important vaccine.
Thanks. Moving on to number 7. I see that some health units are further ahead than others. Why is this?
So there's a number of reasons that determine how our eligibility opens and who's resourced and what the local needs are, and that is what makes all of our local health units, all 34 in the province of Ontario, unique. So some of that depends on rates of transmission, on numbers of cases, whether or not they've been deemed a hotspot, whether or not they have the capacity to handle increased doses based on their population. So certainly we're not in a position to compare ourselves with some of the bigger urban metropolis in Ontario, and we're pleased to offer a local experience here based on the numbers of vaccines that have been allocated to us from the province of Ontario.
Number 8, the province said hotspots are 18 plus. Why is ours only at 45 plus?
So the province, when they released the hotspots in Ontario, we did receive information that our N5H postal code in Southwestern Public Health would be deemed a hotspot. They very much, and similar to our approach throughout the vaccine rollout, recognize the importance of age-related risks associated with the outcomes of COVID-19. And so we very much took an approach of ensuring that those at highest risk via age receive the vaccines first. And so as our age number goes down, we're pleased to see what the uptake looks like. And again, we're always trying to meet expectations and basing that on vaccine that's coming in to our supplies. So you'll see that the age number is going down, but as we understand it, the 18 plus is for hotspots specifically in the GTA to start out. And again, we're closely looking at our numbers and our uptakes to ensure that we're resourcing this hotspot appropriately.
Great. Number 9, when will my doctor offer vaccinations?
That's a great question, and we've had such wonderful partnerships with our primary care providers in our area. We work very closely with them and have regular meetings with them, and many healthcare providers have reached out and said that they're ready to receive COVID-19 vaccine to administer to eligible populations within their practice. Others have said, let's see how it goes, or that they're not equipped to provide COVID-19 vaccine in their practices for a variety of reasons. As many of you who have participated in these updates along the way, COVID-19 has created challenges on administering vaccine, and some of those could be space and appointments, and even the complexity of handling this very precious vaccine can create some barriers. So not all primary care practices will be having COVID-19 at this point, but we'll be continuing to onboard and welcome primary care providers along this journey, as we know COVID-19 will be something we talk about and vaccinate against for some time.
Number 10, do I even need a second dose?
So our answer would be absolutely you do. We have come so far, and we were so excited to welcome such vaccines to our repertoire of fighting COVID-19 along with the public health measures. And we can't let our guard down now. We've seen how COVID-19 has changed in the year and a bit that it's been with us, and we need to optimize protection. And we know that right now the best way to do that is with a two vaccine series, and keeping your appointment at 112 days when you've been booked is critical to helping end this as soon as we can.
And a follow-up to that is, can I choose a different vaccine brand for my second dose than I had in my first?
So in the province of Ontario right now, the current guidance is that you should finish your vaccine series with the vaccine that you started. And that's what public health units like ourselves are closely monitoring to ensure that appointments are booked for the second doses. Pharmacies are doing the same, and primary care providers are doing the same, ensuring that that second appointment is booked, and ensuring that the same product that was administered the first time is administered the second time. We do know that there's other countries who are trying different modalities to see how it works out. But in Ontario, that's the guidance as it stands right now.
Thanks. And for our last question today is, can I book at a different clinic if I have one closer to me that opened?
So while that is possible, as much as we can avoid that, the better. There is opportunities locally to get that second vaccine, but right now our focus is on first doses in arms. And when we're opening up first doses on the back end of our booking system, we're putting in second doses as well. So very much the possibilities are there, but it does create some complexity, and we don't want anybody to get lost in the shuffle. So we want to make sure sure that that there is reliability to get that second appointment, and we know when we are coming up to second appointments that there'll be a whole bunch of new people who need first appointments as well. So it gets a bit complicated on the booking side of things, and we don't want anybody to get lost. So as much as you can stick with that second appointment where you booked it, we would appreciate it, but we understand that's not always possible for everyone, and we always want to have a client-centered approach. So if there are challenges or reasons why you would need to change out, then there's ways to do that.
Thanks so much, Jamie. We'll just have you stand by, and we'll now open it up to media for questions, beginning with Ian McCallum from MyFM, please.
It's to piggyback on one of the questions you answered. After the first shot, what is the sort of lag time before there would be some efficiency there? And what would the efficacy rate be of that first shot until you get the second shot?
Yeah, so when we're looking at first shots, we know we're getting a very good protection for most individuals. Again, it's an individual experience with people with compromised immune systems, or some of the aging process can have, impacts on how much somebody launches the protection against the first dose. But, we're seeing somewhere between 88 and 92% after the first dose of the mRNA vaccine. And we do know that the second dose will boost it. And that could be between 5 and 10% for that second dose. But oftentimes we're looking for more that sustained immune response by having that booster afterwards. So we're looking less at the increased efficacy and more about the sustained response.
And just to piggyback on that, does it take 2 to 3 weeks before you get that protection from the first immunization?
So with all immunizations, as soon as your body starts recognizing that you've had a vaccine, your body's immune system kicks in. It's such a wonderful, fascinating biological response that happens with immune response following vaccination. So what we inform people as part of our health teaching is that on every day that goes by, you'll have more and more protection, but that usually within 2 weeks, you'll have reached the type of protection that we're looking to say would be where the best reach would be. So after about 2 weeks, you would have the best level of protection.
Great, thank you, Jamie.
Thanks, Ian. Moving on to Kathleen Sailors from Woodstock Sentinel Review.
Hi there, thank you for taking my question. Can you hear me all right?
I can.
Okay, wonderful. So my first question is around the 27.6% of the total population that have received at least one dose. And I'm wondering, with that September target in mind for having 75% of people vaccinated, is that where we were about expecting to be at this point? Are we ahead of schedule? How does that look in terms of our total timeline and our total goal?
I think it's a great question, and certainly something that we can take back and ask our foundational standards team to have a look from an epidemiological perspective, from an operational perspective as a program manager who's been working in the mass immunization clinic. While the numbers are important, every single dose that we're able to put in arms means more and more people are protected. So, I'm thrilled to see numbers like 27.8% of the population already vaccinated, but we still have a long way to go, and that's certainly what we're telling our teams, that this is a marathon and not a sprint. And we're so excited to see news like increased vaccine supplies coming in to hopefully allow us to achieve that target well ahead of the timeline.
Gotcha, thank you. And then maybe just as a follow-up, with that, roughly a quarter of the population having some vaccine protection, I'm wondering what the messaging is for people who think that they might be able to alter their behavior in terms of socializing with people who have a similar level of protection. What is the current guidance on that once you've received one dose and you've waited to the 2 to 3 weeks to get some immunity?
And I think the key to what you just said was there'll be some immunity. So this is not 100% protection, and we need to, as a community, as a population, remain vigilant and maintain those public health practices, because we do know COVID-19 has behaved in ways from variants of concern to increased levels of infectivity that, immunization is giving us a lot of hope, but we still need people to follow the rules and remain vigilant against COVID-19 until we are further along in this response.
Wonderful. Thank you.
Thanks, Kathleen. Moving on to Rob from the Elmer Express.
Hi, my first question is actually for Dr. Locke, if I could. I know certainly in the last week or two,
Rob?
Oh, sorry.
Can I just ask you to pause, and we'll get Dr. Locke to put her speakers on?
Oh, sure. I can pose a question to you while we wait, if that's okay, or should I wait?
Yep, just 1 second.
Sure.
Yep, go ahead.
Okay. For you, Jamie, what's the current daily capacity for vaccinations at your existing mass vaccination clinics? The two that were existing and the new one. And what will that bring your new total to in terms of how many people you can do in a day or a week, if you prefer, whichever number would be great.
Sound on. In terms of our maximum capacities, we haven't achieved those yet because we haven't had the vaccine to do so. So we're quite prepared to welcome over 1,000 people at our St. Thomas Clinic as it stands right now through our current hours and our current staffing levels. We're up over 500 doses a day at our Woodstock location and 360 doses a day at our Tillsonburg location that just opened up yesterday. So we're starting to approach that 2,000 mark, which we talked about at the start of our mass immunization rollout. And that's without extending hours, and that's without extending days. So on target for 14,000 doses a week if we were ever to be provided that level of vaccination support.
Excellent. And I see Dr. Locke is back on. So I'll just ask, I know in the last week or two, I've been following the demographics in terms of who's been infected. And it seems like the 19 and under category is running at about a quarter pretty consistently, which I think is higher than we've seen before. And I wonder if you could comment on how it's believed these children are, these younger people are becoming infected now that schools are closed.
So there's probably a bunch of different factors there. One, the fact that we vaccinated people over the age of 60 means that we're going to start to see fewer cases in those age brackets, and that we will start to see more of our cases in the younger age brackets. So partly it reflects that the vaccines are doing their job. The other issue is that we are finding with the variants of concerns that we do know that they're more transmissible, and we're particularly finding that they're more transmissible in households. So households include children, so the cases are beginning to show up there as well. So both of those factors are playing a role in seeing more cases in children. And then with the native variant that we had initially, it seemed to have a preference to provide very mild disease in children, and that children weren't playing a big role in spreading it around. It seems that the new variants as well are having a little bit more of an impact on the younger age brackets.
Thanks very much.
Thanks, Rob. Next, we have Chris from Heart FM.
Thanks for taking my questions. Both of mine are actually for Dr. Locke. Dr. Locke, as we speak, people are golfing right now at bridges at Tillsonburg. To date, there's been no fines from bylaw, from OPP. Is there anything the health unit can do about this? And what message does this send to businesses, golf courses that are following the rules?
We do encourage all of our citizens to abide by the rules. The rules are being put in place for a reason. It's for our common good. We have been receiving patients locally from ICUs and hospitals elsewhere because of the significant numbers of cases in wave 2. We do know the variants of concern are much more transmissible people, and so it's all the more important to stay apart. Granted, we found last summer that the outdoors was one of the safest place to be, but we do know that with the increased transmissibility, we really do need people to stay apart. And as much as you may possibly be apart on the golf course, inevitably you're going to be socializing at moments when you cross with other players and in the parking lot. So we do encourage both businesses and citizens to continue to do their part. Vaccines can do part of the job, but not all of the job. We all want to get out of this lockdown, so we all do our part by making that happen by staying apart and abiding by the rules.
Dr. Locke, follow up to that though, is there anything the health unit can do to enforce the rules for places like Bridges at Tillsonburg that continue to operate?
We do work with our internal staff and with our external enforcement partners. We tend to use progressive enforcement techniques, and we escalating as needed.